All right, so we've got a pretty big stack of stuff here about this new Alzheimer's drug, Donanemab. Donanemab, also known as Kisunla. You sent over research articles and news pieces, even a Wikipedia page, and wanted to really get to the bottom of it all. I got to say, I was super intrigued right off the bat. It seems like this drug can actually slow down Alzheimer's, especially if it's caught early on. But then there's this whole other layer about potential side effects and a genetic test that can actually tell you if you're at a higher risk. So to help us break it all down, we've got an expert here with us. Welcome to the Deep Dive.
Glad to be here. It's definitely a lot to cover.
It is. So maybe just starting with the basics. What exactly is Donanemab?
So Donanemab is what's known as a monoclonal antibody, and it's specifically designed to target and remove this protein called amyloid beta from the brain. And the thinking is that the buildup of amyloid beta is one of the main things that causes Alzheimer's.
Okay, so it's like think of our immune systems like they're great at fighting off invaders, right? But sometimes they need a little extra help finding the enemy. So it's almost like donanemab is sending in this tiny little specially trained soldier to attach itself to that harmful amyloid beta and kind of flag it for destruction.
Yeah, that's a really good way to put it.
Yeah.
And it's important to remember that it's not a cure, but the clinical trials are showing that it can really significantly slow down the progression of the disease,
I see.
especially when it's caught in those early stages.
Yeah, and speaking of catching it early, I was reading that Wikipedia article you sent over, and it was talking about how scientists can actually see this amyloid beta buildup, like outside of brain cells. They're using some pretty amazing imaging technology, right?
Yeah, it's pretty incredible. For years, they could only suspect that amyloid beta plaques were a key factor. But now, with these advanced imaging techniques like amyloid PE scans, they can actually visualize and measure those plaques in living patients. It's like they're finally getting this clear picture of what's happening in the brain.
Wow. So the more amyloid beta buildup there is, the worse the Alzheimer's and the faster it progresses.
Exactly. It's almost like those plaques are gumming up the works, preventing brain cells from communicating properly. Imagine your brain cells trying to send messages to each other, but there's all this sticky amyloid beta gunk in the way, disrupting the signals.
Oh, wow. I see. So if you could intervene early and clear out those plaques, I mean, that would be a game changer, right?
Absolutely. The earlier the intervention, the better the chances of preserving brain function and slowing down that disease progression.
Which is exactly what Donanemab is designed to do. Now, one of the research articles you sent mentioned this major clinical trial called Trailblazer ALZ-2, which is ultimately what led to Donanemab's approval. Can you tell us a little bit more about that trial?
Yeah, so Trailblazer LZ2 was a massive global effort with 1736 participants across a bunch of different countries. To give you a sense of the scale, you had investigators from Eli Lilly and Company in Indianapolis, the Boston Center for Memory, even Lund University in Sweden. It was a true collaboration to bring this drug to the forefront.
Wow. It's really amazing to see all those names and to realize it was such a global effort.
Yeah, and importantly, it was a double-blind, placebo-controlled trial, meaning that neither the participants nor the researchers knew who was getting the actual drug
Hmm.
and who was getting a placebo, which is really the gold standard for eliminating bias in medical research. And all of the participants were in the early stages of Alzheimer's, either with mild cognitive impairment or mild dementia.
Okay, so they were looking specifically at those early stages. And what were some of the findings from the trial? Because I know there were some pretty impressive results.
Yeah, they were really encouraging. So to put it in perspective, the people getting Donanemab actually saw their cognitive decline slow down by over a third. Think about that for a second. That's like hitting the pause button on the disease for months.
Wow, that is impressive.
Yeah. So Donanemab slowed the disease progression by 35.1% to be exact, compared to the placebo. And almost half, 47% of the patients who received Donanemab were stable at the 1-year mark, meaning their cognitive function didn't decline at all during that time, compared to only 29% of the patients who received the placebo.
Wow, those are some serious numbers. But then there's this whole other thing about the ApoE4 gene and how it can affect a person's risk of side effects. This is where it starts to feel very personalized, right?
It is. It's not a one-size-fits-all approach at all. Doctors will actually do a genetic test to see if you have a higher risk of side effects before they even consider prescribing this drug. It's personalized medicine in action.
So let's break that down a little bit.
Yeah.
What is the ApoE4 gene and why is it so important in this context?
So the APD4 gene is a really fascinating piece of this whole puzzle. Everyone inherits 2 copies of this gene, one from each parent. And there's a specific version of the gene called ApoE4. That increases your risk of developing Alzheimer's disease. And if you inherit 2 copies of the ApoE4 gene, you're at a much higher risk of experiencing a specific side effect from donanemab. called ARA.
ARA. That sounds kind of concerning. What is that
Yeah,
exactly?
so ARA stands for amyloid-related imaging abnormalities, which basically means that the drug can cause swelling and tiny bleeds in the brain. Now, most cases are mild or moderate and often resolve on their own. But in some cases, it can be more serious, even leading to larger brain bleeds. And that's where the ApoE4 gene comes in, because two copies of the ApoE4 gene means a much higher risk of developing serious ARA.
Oh, I see. So while ARA sounds scary, most cases are mild and they're closely monitored. But doctors need to know your genetic makeup before prescribing Donanemab.
Exactly. It's all about weighing the potential benefits of the drug against the potential risks for each individual patient. That's why in the UK, for example, the approval of Donanemab specifically excludes people who have two copies of the ApoE4 gene for now.
That makes sense. It's like tailoring the treatment to your specific genetic profile.
Exactly. And it's worth noting that approximately 15% of Alzheimer's disease patients actually have two copies of the ApoE4 gene. So this personalized approach could have a big impact on a significant number of people.
Wow, 15%. That's not insignificant at all. But let's talk about maybe the elephant in the room a little bit, side effects. Because, I mean, swelling and bleeding in the brain sounds pretty intense. What should people know about the potential downsides of donanemab?
Yeah, you're right. We can't shy away from the potential downsides. Like any powerful medication, donanemab does come with risks, and ARIA is certainly one of them.
Yeah, one of the research articles mentioned that 24% of the patients in the trial who received donanemab experienced ARA, compared to only 2% in the placebo group. I mean, that's quite a difference.
It is. But it's important to break that down a little further. Of those 24%, only about 6% actually had symptoms. So that means the majority of those ARA cases were actually picked up by those routine MRI scans, but didn't actually cause any noticeable problems for the patients.
So they're finding these tiny changes on brain scans that might not even be causing any noticeable symptoms.
Exactly. That's why that regular monitoring with MRI scans is so important for anyone taking Donanemab. It allows doctors to catch ARA early and adjust treatment if necessary.
Okay, that makes me feel a little bit better about those numbers. But even if most ARA cases are mild, there's still that risk of those larger, more serious brain bleeds, right?
Yeah, that's a valid concern. And while rare, those serious cases can occur. And they can be life-threatening. So that's why doctors really carefully consider each patient's individual risk factors before prescribing Donanemab, and they closely monitor patients throughout the treatment.
Yeah, and to be fair, the clinical trial information did mention that 3 deaths in the Donanemab group were considered treatment related. So it's definitely not something to take lightly.
Absolutely not. The decision to use Donanemab is a really complex one, and it should involve a thorough discussion between the patient, their family, and their healthcare providers,
Yeah.
taking into account all the potential benefits and risks.
Yeah, it sounds like a lot to weigh. Okay, so we've covered a lot of ground here. We talked about the basics of Donanemab, the science behind it, the clinical trial results, the ApoE4 gene and personalized medicine, and the potential side effects. Now let's move on to maybe some of the practicalities here. Is this drug readily available? And if so, how much does it cost?
Yeah, that's a great question. Let's talk about the real-world implications of Donanemab. So the drug was approved in the U.S. in July 2024,
Mm.
and in the U.K. in October 2024.
Okay, that's great news. But I know one of the news articles mentioned that NICE, which is the UK's National Institute for Health and Care Excellence, had some concerns about the drug's cost effectiveness for the NHS.
Yeah, that's a pretty significant hurdle. So NICE evaluates new treatments, and they determine whether those treatments should be covered by the NHS. And they've raised concerns about the overall cost-benefit balance of donanemab, given the potential for serious side effects, and the fact that it only slows disease progression. It doesn't cure it.
Right, so for now, it sounds like Donanemab is not readily available through the NHS.
That's correct. NICE's current recommendation is that it's unlikely to be cost-effective for the NHS. However, this is an ongoing discussion. Things could change as more data becomes available, or if the price of the drug were to come down.
And speaking of price, one of the sources mentioned that in the US, the cost of Donanemab is around $32,000 per year.
It is a significant expense.
Right.
And that's another factor that NICE is taking into consideration. They have to weigh the potential benefits of the drug against its cost and determine whether it represents a responsible use of NHS resources.
So access and affordability are clearly major issues right now. This brings up so many questions about who will be able to benefit from this potentially life-changing drug. What are your thoughts on that?
Yeah, it's a really complex issue. I mean, you're talking about balancing hope for patients
Mm.
with, responsible resource allocation.
Yeah.
and making sure that there's equitable access to these potentially life-saving treatments. It's a discussion that goes way beyond just the science.
It really does. Okay, so back to Donanemab itself. We've talked about the potential benefits and risks. But how effective is this drug really? I mean, are we talking about a small improvement
Yeah.
or a significant change in a person's life?
Right. Well, it's important to remember that Donanemab isn't a cure for Alzheimer's disease. It doesn't reverse any existing damage or completely stop the disease from progressing. What it does do, as we've seen in the clinical trial data, is it slows down that decline in cognitive function and the ability to do everyday things.
Right, and those numbers from the trial were pretty impressive. But what does that actually look like in someone's day-to-day life? Can you give me some real-world examples?
Sure, so let's say someone in the early stages of Alzheimer's is starting to have trouble remembering appointments, or following recipes, or managing their finances. Donanemab might help them continue doing those things for several months longer than they would without treatment.
Oh, so it's about extending that period of independence and quality of life.
Exactly. It's about giving people more time to enjoy their hobbies, spend quality time with loved ones, and just maintain that sense of normalcy and control over their lives. Even a few months can make a world of difference.
Yeah, that's really powerful. And I imagine for families who are watching a loved one struggle with Alzheimer's, those extra months can be incredibly precious.
Absolutely. And it's not just about the patient themselves either. It's about the impact on their families and caregivers too. Slowing down the progression of Alzheimer's can really alleviate some of the burden on caregivers and allow them to provide support in a more sustainable way.
Yeah, it's a good reminder that Alzheimer's is a disease that affects entire families, not just the person diagnosed.
Exactly. The ripple effects of a treatment like Donanemab, with the potential to slow down the disease, they can extend far beyond the patient.
Okay, so we've covered a lot of ground here. The basics of Donanemab, the science behind it, the clinical trial results, the ApoE4 gene in personalized medicine, the potential side effects, and the issues of access and cost. I feel like we've gained a really good understanding of this new drug.
I agree. We've explored the key aspects of Donanemab, and I think you're well equipped now to understand the information you're seeing out in the world.
I think so too. But before we wrap up, I have one final question.
Yeah.
Given everything we've discussed, if you were eligible for Donanemab, what factors would you personally consider most in making your decision?
That's a great question, and it's a really personal one that each individual has to answer for themselves, obviously in consultation with their healthcare providers. But for me, the primary consideration would be the severity of my symptoms and how much the disease is already impacting my life.
Okay, so if you were in those very early stages with minimal symptoms, you might be more hesitant to take on the risk of side effects.
Potentially, yeah. But if the disease were progressing more rapidly, and I was already experiencing significant cognitive decline, the potential benefits of slowing that decline might outweigh the risks for me. It's a tough call.
I see. So it's about finding that balance between the potential benefits and the potential risks, which will be different for each person.
Exactly. And it's also important to factor in your personal values and preferences. Some people are much more risk averse than others, while some might be willing to accept a higher level of risk for the chance of even a small improvement in their condition.
And of course, access and affordability play a role too. I mean, if the drug isn't covered by insurance or it's prohibitively expensive, that's a major barrier for a lot of people.
Absolutely. Those are all real-world considerations that can't be ignored. It's really crucial to have open and honest conversations with healthcare providers about all of these factors to make the most informed decision possible.
This has been such an insightful discussion. I feel like I've learned so much about Donanemab and just the complexities of Alzheimer's disease in general. Thank you so much for sharing your expertise with us today.
You're most welcome. It's been a pleasure discussing this important topic.
And to our listeners, we hope you found this deep dive into Donanemab helpful and informative. As always, we encourage you to continue exploring this topic, ask questions, and have those thoughtful conversations with your healthcare providers. And remember, even though we're wrapping up this deep dive, the conversation about Alzheimer's disease and the search for effective treatments continues.
It absolutely does. And I think it's important to emphasize that while Donanemab IS, a promising step forward, it's just one piece of the puzzle. The field of Alzheimer's research is constantly evolving, and we're likely to see even more breakthroughs in the years to come.
That's so encouraging to hear. It feels like we're on the cusp of a new era in Alzheimer's treatment, and Donanemab is just the beginning. So what's next? What are some of the big questions that researchers are grappling with right now?
Well, it has been my pleasure. And to our listener, thank you for your curiosity and your commitment to understanding this complex and important topic.
It really is a fascinating and rapidly evolving field. And while the science can get pretty complex, I think we've managed to unpack it in a way that's understandable, even for those of us who don't have PhDs in neuroscience.
I hope so.
Yeah,
I think demystifying these advancements and empowering people to have those informed conversations about their health and their treatment options is so crucial.
couldn't agree more. This deep dive into Donanemab has been quite a journey. From those tiny monoclonal antibodies to the much larger ethical considerations around access and affordability.
It really has. And it's just the beginning. The field of Alzheimer's research is so dynamic right now. It really feels like we're on the verge of even more groundbreaking developments in the coming years.
It is incredibly exciting, even with all the challenges and unknowns that come with it. It feels like we're entering a new era in Alzheimer's treatment, and donanemab is just the first step.
I share your optimism. Donanemab may not be a cure, but it's a significant step forward. And I think it's really paving the way for even more innovative and effective therapies in the future.
And hopefully, with increased awareness and continued research, we can overcome those barriers to access and affordability and make sure these potentially life-changing treatments reach everyone who needs them.
I couldn't agree more. That's an ambitious goal, but one that I think we must strive for. The potential to alleviate the suffering caused by Alzheimer's is immense, and we have a collective responsibility to pursue that potential with every resource at our disposal.
Well said. And on that note of hope and determination, we'll wrap up this deep dive into donanemab. Thanks again for joining us on this journey of discovery.
It's been my pleasure.
And to our listener, we hope this deep dive has sparked your curiosity and given you a solid understanding of this new frontier in Alzheimer's treatment. Remember, knowledge is power, and the more we understand, the better prepared we are to navigate the complexities of this disease. Until next time, keep exploring, keep learning, and keep diving deep.